My name's Roussel. I'm a pharmacist, and I'm the Senior Executive Director over Pharmacy, Laboratory, and Medical Research. And what keeps me going is optimism about our therapeutics that we have available to manage COVID right now. From antibodies for our outpatients to therapeutics for our patients who are admitted to the hospital, and especially to vaccines. Vaccines have been controversial for some people, and I think it's due to lack of information. And I want to share that these vaccines have been made safely. So my undergraduate degree is in toxicology, so I'm very passionate about the development of medications done safely. And with all drugs, they start with preclinical research in animals, and then there's 4 phases of drug development. The first phase is safety. So they give it to a small number of people and assess if it was safe. And then the second phase is safety and also dose finding, understanding how much of an agent is going to get the response that we need. And in the case of vaccines, create that immune response that we're looking for. And then phase 3 is a larger group of people where it's really focused on, is this going to work in a bigger group? And then the more people you treat, do we see different side effects? And that's the point where a medication or a vaccine will then get approved and then go on to phase 4 clinical trial, which is it's approved for the general population, but you still monitor the group for safety to see, as you start giving something to millions of people, do we see any side effects? And usually then a product gets approved by the FDA, and then they start figuring out manufacturing. They start scaling it up, because to make a small amount of drug is done very differently than making huge amounts of drugs for millions of people. Now, Operation Warp Speed took a different approach on this. So normally drug companies don't invest in manufacturing till they know that their product has been approved. And only about 14% of drugs actually end up getting approved by the FDA. So instead what they did was they took a financial risk, not a safety risk. And the financial risk was that they started manufacturing the drugs and vaccines and building the infrastructure before the research was even able to be done. And they did this with financial support from our government to be able to expedite that process. And what also expedited it was prioritizing getting inspections of the manufacturing facilities before starting and after starting, instead of waiting for months for the inspectors to be able to find time to get there. And that's what enabled our government to cut down the development of vaccines significantly and be able to bring this therapeutic where it's needed, which is right now. We're super fortunate at Doylestown Health. We've been allocated vaccine in the first round of the government allocations, which is amazing. Today we were in meetings with Pfizer, who's the manufacturer that we'll be getting, and it was day 1 teams. So we're so lucky to be right on the front line using these agents, and they're being prioritized by the Center for Disease Control and the Advisory Committee on Immunization Practices. And they dictate who gets the vaccines first. In this case, the first grouping is healthcare workers and patients in long-term care facilities. For the patients, they're the most at risk, and unfortunately, they make up the highest percentage of mortality from COVID. For the healthcare workers, even within that group, it's the healthcare workers with the most close contact with positive patients, or those who may be positive and are unknown. So we've been working on a team, and we're pretty lucky. We created an amazing vaccination clinic here in our campus. Our rehab unit was moved to a lovely location just on campus across the way, and that space is where we're going to be doing massive vaccination of our associates. And our goal is vaccinate our associates so we can better protect our patients and better care for them. So we've been working hard, and I want other people to feel the optimism I feel when I think about the vaccines. I will be honest, I sometimes jump up and down when the Department of Health calls me and tells us where we fall in line, especially we've been hearing this good news. So what I ask of people is to feel positive and keep social distancing, as that's the thing that's going to be most effective for helping and masking. And also, 2 common questions I get from people are, if I get the vaccine, will I still have to wear a mask? And the answer to that is yes. When we test vaccines, we are testing it to make sure a person doesn't develop the disease. But we're not testing to make sure that they don't develop virus that could transmit to somebody else. We haven't been able to test for that amount. So even though you may be vaccinated and you may not get sick, there's a potential that you could still pass the disease on to somebody else. And then also, vaccines aren't 100%. People who get the flu vaccine still sometimes get the flu, but it's not, they don't get as sick as they would if they weren't vaccinated. So vaccination is very exciting. I really hope it brings a nice opportunity for our community. And if you're interested in more safety information, Doylestown Health continues to put out safety videos and publications, so please stay tuned, because as we get information, we share it, and we really want to help encourage people to understand the science behind it so they can feel more comfortable and be more proactive about the safety of themselves and their loved ones. So thank you so much. I hope to be back with another update soon with more good information about how we can move ourselves forward in a positive way as a community.